Hello, I'm Dr. Lisa Gudenkauf. I'm a clinical health psychologist and assistant professor of psychology at the Mayo Clinic in Arizona. I'm excited to talk with you today about strategies for managing stress throughout cancer survivorship. I wanted to start by explaining my role as a health psychologist. I'm involved in patient care, where we address the interactions of psychological, social, cultural, and biological factors as they relate to health and well-being. I'm also involved in education with communication skills training for medical providers and patient education material development, and I'm involved in research. My main goal is to help manage cancer-related distress and provide opportunities for coping with anxiety or depression in the context of cancer. So when psychologists talk about stress, we usually use the word distress, and the National Comprehensive Cancer Center guidelines has provided a definition for that, which is multifactorial, unpleasant experience of psychological, social, and spiritual nature that may interfere with your ability to cope effectively. This can range from normal adjustment to diagnosable disorders with regard to how interfering your distress is with your life. The good news is we have evidence-based interventions that are tailored to cancer survivors. With comprehensive biopsychosocial interventions, we can actually address multiple concerns at once. And the other good news is that distress actually moderates intervention effects. So the higher the distress, the greater the benefit we see for patients. One of the best researched approaches we know is called cognitive behavioral stress management. It's a comprehensive, often group-based, but can be delivered individually as well, intervention that helps survivors identify your own physiological, emotional, cognitive, and behavioral symptoms of stress, and teaches strategies for managing stress and stress-related symptoms. This book, Cognitive Behavioral Stress Management, authored by Dr. Antoni, Dr. Ironson, and Dr. Schneiderman, is the main source of strategies I'll be speaking about today. The components of these types of interventions include education on the body stress response, relaxation skills training, approach-oriented coping as opposed to avoidance-oriented coping, and problem-solving strategies, interpersonal skills training, promoting health behaviors, symptom management and adherence, and cognitive skills training. We've seen so much benefit from interventions with regard to cancer-related distress and other symptoms. We've seen that interventions have improved cancer-related distress, anxiety, depression, improved quality of life, made people more confident in their ability to cope, enhanced social support, helped people find benefits in their experience, improved adherence and dietary habits, reduced tobacco use, improve endocrine or hormonal functioning, and improve immune functioning. And with more recent research, we've even seen that we can get some of these effects with as few as 5 sessions of education and skills-based training. We know that the challenges expand across the survivorship trajectory. So as early as when we're first diagnosed, we can experience a broad range of emotions from shock to anger. We can feel out of control or overwhelmed and have lots of intrusive thoughts or thoughts that pop into your mind without trying to think about it. Then as we're going through active treatment, we can experience things like depression, anxiety, fatigue, pain, grief, regret, and social withdrawal. And then as we transition out of treatment, living beyond treatment, we still have some challenges that we may face, such as fear of recurrence, coping with long-term and late effects of treatment, and reintegration into our work, family, and social lives. So it's important as we consider moving out of treatment and into survivorship beyond treatment that we shift gears and remember life is a marathon and not a sprint. That's going to be a helpful phrasing for us as we consider strategies that will be helpful. One of the most important things for us to develop when we're thinking of skills for managing stress is awareness. We want to first be aware of what does it look like when we're feeling stressed? What does it feel like? We can sometimes ask our partners or family members, how do you know when I'm stressed? And that can be informative too. So we see symptoms across physical symptoms like back pain, muscle tension, stomach ache, headache, sleep disturbance, and fatigue. We also see emotional symptoms, worry, irritability, sadness, anger, anxiety, guilt, mood swings, and hopelessness. All of these can be signs and symptoms of stress. Cognitive symptoms like difficulty concentrating, trouble remembering, feeling confused, or catastrophizing. And that's a fancy psychology term for expecting the worst or predicting the worst case scenario outcome. Behavioral symptoms of stress could be snapping at others, overworking, impulsivity, difficulty with pacing, or pacing around the house, both apply, social withdrawal, substance use, or more conflict in our relationships. It's really important to be able to identify these symptoms because once we know them, we can use the appropriate coping strategies. The skills that match with these types of stress symptoms include relaxation skills, cognitive reappraisal skills, and behavioral skills, and I'll talk about each. There are so many different types of relaxation strategies that can be helpful. You may have tried a few of these. Diaphragmatic breathing, body scan from head to toe or toe to head with muscle relaxation, mindfulness, or trying to live in the moment, imagery and visualization, as you see here, the beach scene imagery. All of these are intended to reduce your overall stress level. And thinking about your sympathetic nervous system or your stress response, we really want to tone that down to help give our body and our brain a break from stress. Diaphragmatic breathing, we know, is the foundational skill for all of these relaxation strategies. So it's important to practice this one above all others. And as we practice the other ones too. Belly breathing is another word for this, and it means that you're breathing with your diaphragm, which is down in the belly area. And it's really nice to consider that this belly breathing is a very portable tool you can take with you wherever you go. It calms our nervous system. And the most important components are to remember to pause before your exhale, and the exhale is where it's at. So really draw out, slow exhale like you're blowing out a birthday candle. Or maybe not blowing it out, just trying to make the flame flicker without blowing the flame out, nice and slow. So some different types of breathing timings include a 4-second inhale, a 2-second pause, and then a 6-second exhale. There's no gold standard for exactly how you have to breathe, but this is one way you could try it. There's also a free website called exhaler.com. Notice the emphasis on the exhale. And this website is a really great opportunity for practicing and pacing your breathing, your slow belly breathing. There are so many apps out there, we all know, but if you haven't tried them, there's some really great coach apps. Each of these are developed by the VA, and at least some of these are also developed by the Department of Defense, some with Stanford, and other collaborations. These are free apps, so these are fantastic resources that give lots of great coping strategies, including relaxation strategies. The Headspace or the Calm app are other two apps that are not free, but are great resources too. I want to explain a little bit about what the cognitive behavioral model entails. Whenever we have a particular situation, the effect of that situation on us depends on how we think about that situation and how we respond. So I may think a certain way, which impacts how I feel, which then impacts my behavior. The intervention here is really not to change how you feel or to tell you just to feel a certain way. We can't turn our emotions on and off like a light switch, and that's very invalidating when people suggest that we can. Instead, what we want to try to do is focus on changing how we're thinking about things and change our behaviors. Indirectly, that will help us change how we feel. Keep in mind, this is not the power of positive thinking. We're not trying to be overly strict about telling people they must think positively. Instead, what we're trying to encourage is realistic thinking and helpful thinking. And I'll give some examples of that. Think about ways to recognize and reframe our unhelpful thinking patterns. One important way is to ask questions. This could be, what can I actually control in this situation versus what's outside of my control? Do I know for certain that something bad will happen? Is my response helping me right now? If it does happen, how could I handle it? And a very important one is, what would I tell a friend? We're often much kinder to other people in our lives than we are to ourselves. Another important strategy is to focus on today. Yes, we have lots of worries about the future and the past, but staying in the present moment and focusing on today's experiences is one of the best ways we can cope. There are so many moments in each day that we can appreciate, and keeping in mind that although every day may not be good, there is something good in every day. It's also helpful to match your coping strategy with the situation. For example, when you're diagnosed with cancer, it's important to recognize that there are both controllable and uncontrollable aspects of that situation. The controllable parts might be choosing my doctor, seeking a second opinion, or deciding on treatment. The uncontrollable parts might be the fact that I have cancer, the fact that I'll need follow-up, and maybe the cost of treatment. Once we have this identified, we can match our coping strategies appropriately. For the controllable things, it's really helpful to have a problem-solving approach. We want to change a problem or parts of the problem to reduce our stress. We can get information, we can set goals, we can make decisions, we can resolve conflict, and we can request help. If it's uncontrollable, it's best to focus on how we feel about the situation rather than trying to fix the situation itself. So I might feel better by reframing my thought, relaxation exercises, use health behaviors like exercise, engage in pleasurable activities, or seek social support. In terms of behavioral strategies, it's really important to have a skill of being able to use our social support effectively. One way to do this is to make a list of people who are available and willing to help. Once we know this, we can decide what kind of support would I like. The more specific we can be, the better. So if we can ask our partner that we would like emotional support, or tell our best friend we'd like dinner, or tell our doctor we're looking for more information or we have questions to be answered. When we can be specific about what we need, we can make specific requests, and people are happy to meet those specific requests. It's good to communicate assertively, and don't be afraid to ask for help. We know too that it's been a tough time during the pandemic, and now our social support can look more like this. So one of the important strategies of social support is to get creative. Especially with physical distancing, a lot of people have been challenged to be adaptable and flexible in how they seek their social support. We've gotten a lot of good feedback from people about different ways they've done this and gotten creative during the pandemic. Things like making sure we reconnect over phone, text, we could send pictures or memes, old school letters. We can do phone games or shared goals. Maybe we each do yoga and then we check in with each other about it. Netflix party movies, tailgate parties and parking lots, Airbnb experiences, and other virtual options. The list goes on. So really be creative, get flexible, and adapt. And that's how we can cope best in our changing world. Also, don't forget your healthy habits. They're critical to the foundation of your health and well-being. And we know that behavior change and goal setting can help with symptom management, even long-term, especially long-term, in fact. Our sleep habits, our eating habits, and our physical activity play a big role and make a difference. It's also important to make sure you're comfortable asking for help. Many people ask, when do I know I should ask for help? And the answer would be if you're feeling significant distress that lasts for maybe 2 weeks or more, and if you're having difficulty doing your daily activities or functioning. So let's say you feel kind of hyper alert with anxiety, insomnia, irritability, and that lasts for some days or weeks. Also, if you're avoiding reminders of a traumatic event, or if you're feeling numb or using substances in order to cope. So those would be ways we could say, maybe I could use some additional coping strategies and seek out help with a psychologist, therapist, social worker, chaplain, whoever you can find for support and get connected. We also want to say that you can use self-help resources to help yourself, by seeking out education resources and individually learning skills to prevent and manage distress and enhance your functioning. We consider this a stepped care model. So sometimes you can get along just fine learning on your own, and other times it's helpful to have a professional's help. There are many different education materials that Mayo provides, many of them available online. But remember that there are so many resources out there that you can use and be considering ways to learn and grow and cope independently. We also want to remember that our caregivers deserve support too. It's important that everyone in the family gets the help that they need. Thank you for your time today. I hope this was a helpful overview of stress management strategies. And if you're looking for more help, please reach out. I appreciate your time today and have a great day.